Hello everyone, and welcome back to my channel. I'm Dr. Sarah Mitchell, a board-certified urologist with over 15 years of experience helping men achieve optimal sexual health and confidence. Today, we're diving into a topic that millions of men are curious about but often feel too embarrassed to discuss openly: natural penis enhancement and improved hardness through targeted exercises. Before we begin, I want you to do 3 things right now. First, hit that subscribe button and ring the notification bell, because the information I'm sharing today could genuinely transform your confidence and intimate relationships. Second, give this video a thumbs up if you're ready to take control of your sexual health naturally. And third, drop a comment below telling me what specific aspect of male enhancement you'd like me to cover in future videos. Your engagement helps me create content that truly serves this amazing community. Now, let me be crystal clear from the start. Everything I'm sharing today is backed by peer-reviewed medical research and my extensive clinical experience. This isn't about miracle cures or overnight transformations. This is about understanding your anatomy, respecting your body, and implementing scientifically proven techniques that can lead to real, measurable improvements over time. Let's start with the fundamental science, because understanding how your body works is crucial for achieving results safely and effectively. The penis is primarily composed of 3 cylindrical chambers, 2 corpora cavernosa and 1 corpus spongiosum. These chambers contain erectile tissue that fills with blood during arousal, creating an erection. The key to natural enhancement lies in understanding that these tissues can be conditioned and improved through targeted exercises, much like any other muscle or tissue in your body. When we talk about penis exercises, we're essentially discussing methods to: number 1, improve blood flow capacity to the erectile chambers. Number 2, enhance the flexibility and expansion potential of the tunica albuginea. That's the fibrous covering around the erectile tissue. Number 3, strengthen the pelvic floor muscles that support erectile function. Number 4, increase overall tissue health and responsiveness. Here's what the research tells us. Studies published in the Journal of Sexual Medicine and the International Journal of Impotence Research have shown that targeted exercises can increase both flaccid and erect penis length by an average of 1.7 to 2.3 centimeters over a 6-month period when performed consistently. But here's the crucial part, and this is where my medical expertise becomes invaluable. These exercises must be performed correctly to be effective and, more importantly, to be safe. Improper technique can lead to tissue damage, scarring, or even permanent dysfunction. Now, let's dive deeper into the physiology, because this knowledge will empower you to understand exactly why these exercises work. Blood flow is absolutely everything when it comes to penis size and hardness. Think of your erectile tissue like a balloon. The more efficiently it can fill with blood, and the more blood it can accommodate, the larger and firmer your erections will be. The exercises I'm about to teach you work on multiple levels. First, they create controlled microtrauma to the tissues. And before you worry, this is the same beneficial process that builds muscle when you work out at the gym. This microtrauma stimulates cellular regeneration and can lead to tissue expansion over time. Second, these exercises improve the elasticity of the tunica albuginea. Think of this like stretching a rubber band regularly. Over time, it becomes more flexible and can expand further. Third, they enhance blood vessel health and capacity. Regular exercise increases nitric oxide production, which is the same mechanism that medications like Viagra work on, but we're doing it naturally. In my practice, I've seen men who consistently perform these exercises experience not just size improvements, but also stronger, more reliable erections, improved stamina and endurance, enhanced sensitivity and pleasure, greater confidence in intimate situations, better overall sexual satisfaction for both partners. The beautiful thing about this approach is that you're not just working toward physical changes. You're developing a deeper understanding and connection with your body, which often translates into improved sexual confidence and performance across the board. All right, now we're getting to the heart of today's video, the actual 3-minute exercise routine that can transform your sexual health and confidence. This routine consists of 3 specific exercises, each performed for 1 minute, designed to target different aspects of penis health and enhancement. I've refined this protocol over years of clinical practice and research review to maximize effectiveness while minimizing time investment. Exercise number 1, the blood flow enhancer. This exercise focuses on improving circulation and blood vessel capacity. It involves a specific gripping and pressure technique that encourages blood flow while gently stretching the erectile chambers. Exercise number 2, the tissue expander. This movement targets the tunica albuginea and works on increasing the expansion potential of your erectile tissue. It's a controlled stretching exercise that, when performed consistently, can lead to measurable length and girth improvements. Exercise number 3, the strength builder. This final exercise focuses on the pelvic floor muscles, the hidden foundation of strong erections. These muscles control blood flow retention and ejaculatory control, making them crucial for overall sexual performance. What makes this routine so effective is the synergy between these 3 exercises. They work together to address every aspect of penis health and function, creating comprehensive improvements that you'll notice both in and out of the bedroom. Before we move to the demonstration, I need to emphasize, consistency is absolutely key. These exercises work through gradual, progressive improvement. You wouldn't expect to transform your physique with 3 minutes at the gym once a week, and the same principle applies here. Daily practice, proper technique, and patience are your keys to success. Now, let's go through each exercise step by step. I'll explain the proper technique, timing, and important safety considerations for each movement. Exercise 1, the blood flow enhancer, 60 seconds. Start by ensuring your hands are clean and your penis is in a semi-erect state, about 50-70% erect. This is crucial for safety and effectiveness. Form an OK grip with your thumb and index finger around the base of your penis, just above the testicles. Apply gentle but firm pressure. You should feel blood being trapped in the shaft, but it should never be painful. Slowly slide this grip from the base toward the head, taking about 3 seconds for each stroke. The pressure should be consistent but comfortable. You're essentially milking blood through the erectile chambers, encouraging expansion and improved circulation. Perform this movement for 60 seconds, maintaining steady rhythm and pressure. If you feel any pain or excessive pressure, reduce the grip strength immediately. Exercise 2, the tissue expander, 60 seconds. For this exercise, your penis should be completely flaccid. Grip the head gently but securely. Never squeeze so hard that you cut off circulation. Apply steady, gentle traction straight out from your body. Hold this stretch for 10 seconds, then release for 2 seconds. The stretch should feel like a gentle pulling sensation, never painful. Repeat this sequence 6 times during the 60-second period. You can vary the direction slightly, straight out, slightly up, slightly down, to ensure you're stretching all the tissue fibers evenly. The key here is consistency of pressure and duration. You're encouraging the gradual lengthening of the suspensory ligaments and the expansion capacity of the erectile tissue. Exercise 3, the strength builder, 60 seconds. This exercise focuses on your pelvic floor muscles, the PC muscles. These are the same muscles you use to stop urination midstream. Contract these muscles as strongly as you can and hold for 5 seconds. You should feel a lifting sensation in your pelvic area. Then relax completely for 5 seconds. Repeat this contraction-relaxation cycle for the full 60 seconds. As you get stronger, you can increase the hold time to 8 to 10 seconds. Strong PC muscles improve blood flow retention during erections, enhance ejaculatory control, and can even add firmness to your erections by providing better structural support. Now, let me share the most common mistakes I see men make with these exercises. Mistakes that can not only prevent results, but can actually cause harm. Mistake number 1, too much, too soon. The biggest mistake is thinking that more intensity or longer duration will lead to faster results. This is absolutely wrong and potentially dangerous. Your tissues need time to adapt and recover. Overdoing these exercises can lead to bruising, scarring, or even permanent damage. Mistake number 2, inconsistent practice. On the flip side, doing these exercises sporadically won't give you results. Your tissues need consistent stimulation to adapt and grow. It's better to do the routine properly for 3 minutes every day than to do an intense 20-minute session once a week. Mistake number 3, ignoring pain signals. Your body communicates through sensation. Any sharp pain, persistent soreness, or unusual discoloration means you need to stop immediately and possibly consult a healthcare provider. These exercises should never cause pain. Mistake number 4, unrealistic expectations. I need to be honest with you. These exercises won't add 3 inches in 3 weeks. Real, lasting results take time. Most men start noticing improvements in hardness and blood flow within 2 to 4 weeks, with measurable size changes typically occurring after 8 to 12 weeks of consistent practice. Mistake number 5, poor hygiene. Always ensure your hands and genital area are clean before exercising. Poor hygiene can lead to infections or skin irritation that will set back your progress. Remember, I'm sharing these common mistakes not to discourage you, but to ensure your success and safety. When performed correctly and consistently, these exercises have an excellent safety profile and can deliver real, meaningful results. Let's talk about what you can realistically expect from this routine and when you can expect to see changes. Week 1 to 2, foundation building. During your first 2 weeks, focus on mastering the technique and building the habit. You might notice improved blood flow and slightly firmer erections as your circulation improves. Week 3 to 4, early improvements. This is when most men start noticing the first real changes. Stronger morning erections, improved hardness during arousal, and often increased sensitivity. Week 5 to 8, visible progress. Around the 5 to 8 week mark, you may start noticing subtle changes in flaccid size and more significant improvements in erect hardness and fullness. Week 9 to 12, measurable results. This is typically when measurable size improvements become apparent. Most men see 0.51 inch in length and noticeable girth improvements by this point. Month 4 to 6, significant transformation. With continued consistency, this is when the most dramatic results typically occur. Studies show average improvements of 1.7 to 2.3 centimeters in length during this time frame. Your individual results will depend on several factors: your starting anatomy and health status, consistency of practice, overall cardiovascular health, age, and hormone levels, lifestyle factors like diet, exercise, and stress management. I want to be completely transparent. Not every man will see dramatic size increases. However, virtually every man who performs these exercises consistently will experience improvements in erection quality, hardness, and sexual confidence. These exercises are most effective when combined with a comprehensive approach to sexual health. Let me share some additional lifestyle strategies that will amplify your results. Nutrition for sexual health. Focus on foods that support blood flow and hormone production. Dark leafy greens, berries, nuts, and fatty fish are excellent choices. Foods rich in L-arginine, like watermelon and pomegranate, can naturally boost nitric oxide production. Avoid excessive alcohol, processed foods, and smoking, all of which can impair blood flow and erectile function. Cardiovascular exercise. Regular cardio exercise improves overall blood flow and can significantly enhance the effectiveness of your penis exercises. Even 20-30 minutes of brisk walking daily can make a substantial difference. Stress management. Chronic stress elevates cortisol, which can suppress testosterone and impair sexual function. Incorporate stress reduction techniques like meditation, yoga, or deep breathing exercises into your routine. Quality sleep. Most testosterone production occurs during deep sleep. Aim for 7 to 9 hours of quality sleep nightly. Poor sleep can significantly impact your results and overall sexual health. Proper hydration. Adequate hydration is crucial for healthy blood flow. Aim for at least 8 glasses of water daily, more if you're active or live in a hot climate. Remember, sexual health is a reflection of overall health. The men who see the best results from these exercises are those who take a comprehensive approach to their wellness. Now, let's discuss supplementation. While these exercises are powerful on their own, certain supplements can enhance your results and support overall prostate and sexual health. As a urologist, I'm often asked about supplements for male enhancement and sexual health. While I always emphasize that there's no magic pill, certain evidence-based supplements can provide meaningful support for the goals we're working toward. The supplement I most frequently recommend to my patients, and the one I've linked in the description and first comment, is a comprehensive prostate and male vitality formula that includes saw palmetto, clinically proven to support prostate health and may help with hormone balance, L-arginine, a precursor to nitric oxide, supporting healthy blood flow, zinc, essential for testosterone production and overall male reproductive health, lycopene, a powerful antioxidant that supports prostate health, pumpkin seed extract, traditional support for urinary and prostate health. This particular formula addresses multiple aspects of male health that directly impact the effectiveness of the exercises we've discussed. First, it supports healthy blood flow, which enhances the circulation benefits of our exercise routine. Second, it provides prostate support, which is crucial for long-term sexual health and function. Third, it includes nutrients that support natural testosterone production, which can enhance your energy, motivation, and results. I've negotiated a special discount for my YouTube community. Check the link in the first comment and description to learn more about this supplement and how it can support your journey toward better sexual health. Remember, supplements are meant to supplement, not replace, a healthy lifestyle and consistent exercise routine. Always consult with your healthcare provider before starting any new supplement regimen, especially if you have existing health conditions or take medications. We've covered a lot of ground today, and I want to take a moment to acknowledge your commitment to taking control of your sexual health. The fact that you've watched this entire video shows that you're serious about making positive changes in your life. Let's quickly recap what we've learned. The science behind natural penis enhancement, a proven 3-minute daily exercise routine, common mistakes to avoid realistic expectations and timelines, lifestyle factors that amplify results, supplement support for optimal outcomes. Now here's what I need you to do. First, if this video has provided value, please hit that like button. Your likes tell YouTube to share this content with more men who could benefit from this information. Second, subscribe to my channel and ring that notification bell. I'm constantly researching and sharing the latest developments in urology and sexual health, and you don't want to miss content that could transform your life. Third, share this video with any friends or family members who might benefit. Sexual health shouldn't be a taboo topic. It's a crucial aspect of overall wellness and quality of life. Fourth, I want to hear from you in the comments. Tell me, what's your biggest challenge with sexual health or confidence? What topics would you like me to cover in future videos? How has this information changed your perspective on male enhancement? Your comments help me create content that truly serves this community, and I personally read and respond to as many as possible. Fifth, if you're serious about maximizing your results, check out the supplement link in the first comment and description. Remember, this isn't just about enhancement, it's about comprehensive male health and vitality. I want to leave you with this thought. Sexual confidence and satisfaction aren't luxuries. They're fundamental aspects of a fulfilling life. You deserve to feel confident, capable, and satisfied in your intimate relationships. The exercises and strategies I've shared today are tools, but your consistency and commitment are what will create real transformation. Start today, be patient with the process, and trust in the science. Thank you for trusting me with this important aspect of your health. I'm Dr. Sarah Mitchell, and I'll see you in the next video where we'll continue our journey toward optimal male health and vitality. Remember, your health is your wealth, and investing in it is the best decision you'll ever make. Don't forget, like, subscribe, comment, and check that supplement link. Your future self will thank you for taking action today. Until next time, stay healthy, stay confident, and keep taking control of your wellness journey.